Hello, everyone. Welcome to day 267 of Humanity Rising. I want to just take a moment as we start to thank everyone for the launch yesterday of our new Masters in Regenerative Action. As many of you know, last spring, as Humanity Rising was getting underway, we had very animated discussions with people all over the world about what was the most appropriate meta theme for Humanity Rising, and indeed for the world as we traverse the vicissitudes of the pandemic. And the consensus that seemed to emerge very dramatically and almost instantaneously is to embrace the whole notion of regeneration. As scientists tell us that we're running out of time, as we come to understand that it is no longer possible to be sustainable with a broken ecology where 60, 70% of the entire biodiversity of the planet has been destroyed over the last 50 years. It was Ed Muller, the president of the University of International Cooperation, that said it's regeneration time. Humanity has to regenerate itself and regenerate the ecology if we have any hope of surviving a time where climate change and a range of other issues are spinning out of control. So we embraced regeneration. And it was a beautiful moment yesterday to launch our reinvention of the MBA here at the Ubiquity University with partners from literally all over the world, with Kate Rayworth, who gave our inaugural course on the foundations of donut economics. Our goal had been 250 students, and as of yesterday, we had well over 300 students from 42 countries, all coming together on Zoom for Kate's inaugural lecture. It was a wonderful time. And so I just wanted to take a moment as we start Humanity Rising today to thank everybody and to acknowledge all the work and the extraordinary goodness that is coalesced through our daily broadcasts and now taking the shape of a global community dedicated to regenerative action. As Ed Muller put it, what we're trying to create here is regeneration first responders. We think of first responders in relationship to hospitals and mental health workers in terms of the pandemic. But more deeply, we need regeneration first responders. So that has now been launched through Humanity Rising. So thank you. Let us take a moment as we begin our program to just pause and just center yourself in your body. Take a few deep breaths. Close your eyes and place your attention on your heart. See if in the next minute, 90 seconds, you can listen to your heartbeat in a spirit of gratitude and thanksgiving that you're alive at this extraordinary moment in the human journey. Thank you, everyone. Now, with an open heart and a heart full of gratitude and love for each and every one of you who are joining our session today, I want to commence our program by just observing that mental health has been probably the most universal implication of COVID. Because whether you got COVID or not, whether you've been vaccinated or not, all of us, almost without exception, have been emotionally and psychologically and mentally challenged by what we've been through since the beginning of the pandemic. Just recall for a moment kind of the shock of having our governments tell us we had to stay home. We couldn't go to work. Our kids couldn't go to school. And most of us thought, well, that's probably going to be over in a couple of weeks. And, by late spring, it's back to business as usual. And here we are 15 months later, and there are new variants. Lockdowns are still happening all over the world. Repeatedly, we've been in lockdown. We're still engaging in physical distancing and mask making, mask wearing, and the mental health effects of this have taken a toll. So today, I really want to acknowledge Lars Munter and David Somek from the Nordic Health 2030 movement and the Europe Health Future Forum, who've been convening all kinds of panels on the whole general issue of public health. And today are focusing attention on mental health, one of the most important issues worldwide that humanity has to face. So Lars, David, welcome, and thank you for everything that you've done to illuminate the community here at Humanity Rising.
Thank you, Jim.
Thank you, Jim. It is certainly a pleasure of being alive at this special occasion. But it is, of course, also at a point in time where you have to be mindful of the fact that it's not a given. There are always challenges before us, and what we've certainly as a collective experienced the last 15, 18 months or so is that it can strike with a surprise. We thought we were going about our business in a world filled with forest fires, Australian forest fires. Anybody remember those? Life is what happens when you're busy making other plans, and certainly it did in this case. Today, we're going to talk more about mental health. This is a part, of course, of our second series with the Nordic Health 2030 movement and the European Health Futures Forum. We began this second series with a talk about health literacy. This is a topic will sort of make its way into the discussion today. And then we talked about, political priorities when it came to health. That will make its way into what we're talking about today. Last week, we talked about digital health and digital components and challenges, and that will also make its way into what we're talking about today. And next week, we'll go talking about challenged groups and how health inequalities also affect. That will be something we will talk about slightly today too. As we all know, my co-host David and I will try to steer you through today's program. David?
Thanks, Lars. Yes, some of you may know, I spent quite a few years in the so-called mental health services. I started training as a psychiatrist in 1975 and spent a few years doing that kind of work. The thing that I want to simply bring to people's attention, because it surprised me, was for years I worked in what were in fact mental illness services and never thought about what mental health meant. And this is one of the issues we're going to try and address today, because if this was a session about mental illness, it would be much more straightforward in one way, but it's much more complicated than that. And Lars, in a sense, was giving you a taster of that like so many health issues, they're intertwining strands, which make managing the whole thing very complicated. But let's start straight away with our participant from the Nordic countries, who I think presents a delightful approach and very helpful approach to the whole issue of what is mental health. And so I'd invite Mary from the Finnish. You introduce yourself, Mary.
Right, I can introduce myself. So good afternoon or good morning or whatever time of the day for everybody at different time zones. So my name is Meri Larivaara, and I'm joining this webinar from Finland, from our capital area. And I am a medical doctor. I am a specialist in health services. I also have a PhD in public health. But aside being medical doctor, I'm also a cultural anthropologist. And I'm now working at an NGO called MIELI Mental Health Finland, where I'm the director of adult mental health promotion. And so I am actually going to talk about mental health and not really about mental illness. And we'll see now whether I can share my slides, as I was able to do when we were practicing this. This looks promising to me. No, not that one, but here. So can you see my slides now?
Yep, perfect.
Excellent. So here is the map of Finland. And I would like to point out that MIELI Mental Health Finland is actually the oldest mental health NGO in the world that is still working continuously. So we are going to be 125 years next year. And we are focusing on promoting mental health and preventing mental health problems. So we are not working on mental illness really, but it's about promotion. And for instance, we advance the mental health literacy of children, adolescents, adults, and the elderly. We are also coordinating a national network of local mental health associations and national crisis centers that are supporting people in different kinds of life crises. But then about our approach to mental health, we are really using the WHO definition of mental health and mental well-being as our starting point for our work. So the idea is that mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively, or is able to make a contribution to their community. So as you can hear from this, it is really about sort of like a resource in life, and not so much about disturbance or disorder or even a stressor or stress factors. And so I wanted to share this picture with you as well, just to give you an idea of what we are talking about when we are talking about mental health. It can be many other things as well, whatever comes to your mind that is related to mental health, but many of these things are very positive. I'm not certain if you can see them really behind your screens, but there are things like life balance and well-being, or ability to love, or awareness of one's own potential, or optimism, or mental growth and development. So a variety of positive things that are really related to all of us. So what I often like to say is that mental health is something that we all have, while many people tend to think that it's actually about mental disorders that only some people have. So also I would like to point out that there are different factors that influence our mental health, and that really influence whether we have good mental health at some point of our life, or whether our mental health can be also sort of diminished at some certain points of life. Mental health is also an asset that can be strengthened, or that can be really sort of strained, and that can decrease when we have difficulties in our life. But we have individual factors that influence our mental health. So this is about biology, but it's also about learned skills and our experiences in life, what kind of a life course we have had. Then there are social and interpersonal factors that influence our mental health, and also the structural factors in society. For instance, what kind of safety nets do we have in a society? And then it's also about cultural values. Then I wanted to share with you this picture that really explains that mental health, the relationship between mental well-being and mental health disorders. So they are actually two dimensions that are related, but they are not really, but they are still independent. So when we look at the two dimensions where we have good or poor mental well-being, and then the presence of mental health disorders or not their presence, we can actually create a picture where we have four corners. And in these corners, we have different situations with mental health. There can be, for instance, a person who has a mental disorder, let's say, for instance, a bipolar disorder, but yet the person can have good mental well-being and can live and lead a balanced life and can actually enjoy his or her life very nicely. Well, then I would like to make a point of the fact that the significance of mental health is increasing in our societies. It is partly because work is changing. Our mind is increasingly a crucial tool for us at our work. Also, we have more opportunities and requirements to make choices in life, and that requires mental resilience. It requires lifelong learning, and it also requires ability to make independent decisions. Also, our values and lifestyles are becoming more varied, and that also can create challenges to our mental health. And then there is all technological development. There are other sort of trends in our societies as well that can be a challenge to mental health, but these are really issues that are making the relevance of mental health increasing. Then I wanted to say something about how we perceive in Finland the idea of promoting mental health. We really think we need to work across policy sectors and apply health in all policies also to mental health. For instance, we think we should build everyday environments that have practices that strengthen mental health. For example, they can be schools or workplaces or our leisure time activities. So it is not so much about social and health services, but more about the environments where we are living. Then it's about interactions and encounters that strengthen resources and resilience in us. And then it's also about mental health awareness, mental health literacy, and mental health skills for professionals who meet people at different sectors and for lay people of different ages. As for mental health skills, I wanted to give you an idea what we mean with them, because it's not always so obvious to everybody. So we think mental health skills include emotional skills, self-awareness skills, life skills, interpersonal skills, problem-solving skills, and the ability to seek help. And based on these ideas, we think really that mental health is a resource that can be strengthened in each and every one of us. And in Finland, for instance, we actually teach these skills nowadays at school to children as part of our national curriculum. But I think these were all my slides. No, there was one important slide that actually resonates nicely to the COVID-19 pandemic. We have been talking about herd immunity to the COVID-19 virus, and it's really an important issue when we are talking about vaccinations. But actually, we have this sort of an idea in Finland that when most people in a community have mental health skills, even those who are more vulnerable will be protected, and that can create us a herd immunity against mental health problems. So that was my last slide, I think. And now we are probably ready for discussion.
That was a wonderful introduction the subject, Mary. Thank you so much. I have to say, it shows, doesn't it, that we've talked about health literacy and so on and so forth, but didn't include the mental sphere, and yet it's so obvious that it should be within that whole framework, but we tend to split them off. And what you're doing in Finland with schools is amazing, but does show that it is possible, because we all agree, don't we, that self-care really has to be taught and started from an early age, really. But Lars, your comments.
Well, it's a wonderful way of showing with the diagram where you see the the element of having, well, no mental disorders, but still a poor mental well-being. And in this case, of course, they can be almost suffering more than the ones with a mental disorder, but with a good mental well-being. This is not a matter of debating the value of positive psychology, but clearly what we see, for instance, and with the comments in the chat here, we have a lot of people, some of them young, that are clearly suffering from a poor mental well-being at this stage. They don't have any mental disorders, and we're not medicalizing them, but we have an enormous challenge in that. It's a very good point of pointing that out. And now, for that matter, we have, for instance, if you could dive into that a little bit more, Mary, if this was about physical health, we would have athletics programs where we had introduced how to get these kids to go out running or biking or whatever. Why is it that, for instance, we don't have all these mental health awareness days where we tackle those issues and get them to train more on their mental health? Is this simply because we don't do it? Is this taboo, or is it just beyond the horizon?
Well, I think it's something related to the fact that the idea of mental health as a positive energy and as a positive resource in life is kind of new still. We tend to think that mental health promotion is like early detection of mental health disorders and early treatment for them. And we don't really realize that we can really strengthen everybody's mental health and provide them resilience through giving them understanding of what mental health is and how it can be promoted. So I think it's really about the thing that it's kind of a new notion still. But really, we do have practical things that we can teach to children. For instance, it can be mindfulness skills, or it can be really practice in how to interact with others, or how to identify your emotions, how to give names to your emotions, and how to sort of stop to think of them and recognize how you're feeling and what can sort of trigger those feelings. There are really practical things that you can come up with.
I think the other thing is, I was very struck when I saw your slide with the 2 factors and the 4 quadrants, because I was sitting in, dutifully, a very heavy webinar a few days ago for the European Commission on their study of mental health in the workplace. And lo and behold, exactly the same diagram appeared. So there is a recognition. In this case, it wasn't about so much what can the individual do, but also what responsibility employers have to recognize that their workforce needs, and of course there are good economic reasons to do it apart from any social goodwill ones, but to recognize the importance of that lower right quadrant of people with low mental health, low mental wellness, even though they're not mentally ill. And it's as you say, it's an emerging field, isn't it? But something you just wonder, why did it take us so long?
Yeah, true. But over time, for instance, I know that the introduction of physical education in schools, that is 100 years old, perhaps. I mean, we've had schools for 1,000 years, but it took us some time to get to that one. So maybe it's also a natural response to an emerging new society where this is simply something that we need to teach more to learn more about a natural response to an evolving situation. But I was struck also by how one could do that, having simply as part of a 1 hour every week where you have mindfulness exercises, mentalization exercises. I'm looking very much at the school and educational system, David. You can talk about the workplaces today. Yeah. But it's
I want to move the conversation on. Mary, we're going to hopefully have a panel discussion, as you know, later on. But I want to now switch, if you don't mind, Lars. If we go to our next participant, he's someone from my own country, and I know his organization well from when I was working in the trade, as it were, and that's Rethink Mental Illness. Now, Jonathan is welcome, Jonathan. Jonathan's going to talk about really the social matrix in which mental health might need to be looked after. Maybe you can explain to us what I'm getting at. Jonathan, welcome.
Thank you, David. I'll just share my screen. Can everyone see that?
Yeah, it's fine. You need to just do full screen, you know, the full.
Okay. So I guess the question and the discussion points that we're looking at today is around the future of mental health. And what is the future of mental health? Well, obviously I can't answer that because I can't see into the future. But what we can do is strive to influence and mould a brighter future for everyone who needs support with their mental health and well-being. So if we were to dream of the ideal system, what would we want to see? So I would argue what we would like is something that's accessible for all, something that's preventative by nature, so it promotes mental health well-being, resilience building, everything that Mary has just touched upon. I completely wholeheartedly agreed with everything in the presentation. Community-based, holistic model, basically a model of mental health that supports every member of its society, providing appropriate, high-quality support for all of its community. So how would we get there if we were to ever get to this position? How would we come together to create communities that care and look after each other? So we believe one approach is an approach through generous leadership, and this is an approach that we're adopting with Rethink Mental Illness in the UK, in England. And we've broken it down into 5 steps to help guide those who want to lead by example. So the first step is around leadership and governance. So we think it's important to identify leaders within the community across the network of mental health providers, community leaders, etc. Identify leaders at different levels within society, giving clear direction and roles, being pragmatic and getting decision makers on board, considering how we're going to meet and discuss and have a roadmap of meetings ahead to come together. We believe that there's a need to design any new services with those people that have experienced mental health issues before, ex-service users or experts by experience, as we tend to call them, help define the scope of the redesign of what's required, try to avoid mistakes made in the past, co-design action plans that dictate the what, how, who, and when. And I think underpinning all of this work, it's important to have certain values at heart, such as equality, honesty, openness, and respect in this process. The third factor I've put is mapping community assets. So essentially, that's looking at what support is already provided within your community. This should include not only the clinical services or statutory services, but should include many, many sectors. So we talked about education. It should look at education, but what's the housing provision? What's financial helps out there? What employment help? What help and support? What physical activities are available to people? Because there's a huge link between physical health and mental health, as we know. What community spaces are there? Are there active groups, forums, peer support networks, etc.? So let's get a full understanding of what is out there. Now, the fourth factor is alliance building. And if you look at the two images on the left of the slide, those of you who are fans of the show will recognize the top one is the Game of Thrones. And I've included that because often the provision of services, whether they be mental health or physical health, it's almost like an episode of Game of Thrones, because there's a lot of self-serving organizations or individuals there wanting to take over the marketplace, or it's all with vested interest. But what we want to do is we want to get a place where everybody belongs. So what we would suggest for alliance building is looking at creating partnerships to deliver services opposed to individual organizations. You need to set aside commercial rivalries and priorities, which is a very unpopular message when you're talking to private healthcare providers at times. And you've also got to be big enough to recognize that there are going to be issues and different ways of doing things, and that they will need to be smoothed out. Not wishing to be condescending, but essentially we need to be the adult in the room, and we need to agree principles and joint ways of working. Leadership's important in the alliance building process to drive forward the partnerships and avoid any mission drift that can occur in these forums. And it's also important to reflect the diversity of the community and prevent any marginalization of certain cohorts within that right from the get-go, and get it right from the start. And then finally, moving on and looking at the workforce. You need to think creatively about roles and how you're going to fill them. Don't simply move existing members of staff around into different roles or give them a different job title. Consider where peer support can come into it, where experts by experience can inform. You can consider utilising volunteers. You can look at different sections of the community, different skill sets. Think about a preventative, community-based, holistic model. That's your aim. That's what you're going for. It's got to be accessible for all. There's also got to be an appropriate interface and relationship between clinical staff and non-clinical staff. Too often, there's too much emphasis placed on the clinical model of delivering mental health services. And often that comes in when somebody's got a mental disorder. And as we've just heard, it's not all about mental disorders or mental illness. Everybody's got mental health the same way we've got physical health. Some days we're mentally healthier than others days. And that's important to remember. So there's got to be equality between clinical and non-clinical staff. And consider having ambitions of sharing a workforce development plan to move everything forward. So that was a bigger picture around generous leadership, about creating a community approach, which is a different way of delivering care for people's mental health and well-being. So moving on, I just wanted to quickly share with you an example of a piece of work that we're currently running, thanks to a grant from the Johnson & Johnson Foundation. And that's the Community Mental Health Care Navigator. And this is just an example of how one post with the philosophy that I've been talking about can be so impactful. So the context is we have a mental health navigator embedded in a primary healthcare setting, a setting that serves the whole of the local community. So anybody coming along with any physical or mental health needs, this is their first point of contact. They would go to visit their doctor, their GP, the medical practitioner there. And if they give a mental health presentation of any degree, they can be referred to our navigator. And this was set up just as COVID was kicking off. So this role, we have found after it's been running for about a year now, has offered one commodity that the system just doesn't appear to have. And that's time. Seeing a clinician, you're often, as a GP, you're often given a 7 and 8 or 9 minute meeting where you've got to go in and say before the next patient's due in. So what happens is that the doctor will refer someone to a navigator who will spend time to genuinely listen and understand what the underlying reason for the mental health presentation is. They'll complete a holistic needs assessment on them. And what we find is people will present with low-level mental health issues like stress, anxiety, a touch of depression, difficulty sleeping, but very, very often the underlying cause is a non-medical reason. It's not indicative of having a mental disorder. People may be anxious because they're in debt or because their housing isn't suitable, etc. So it's important to understand this, and this is where we go back to the need for non-clinical to be on an equal footing with clinical staff. The community asset mapping that I mentioned previously, this has been done by our navigator. And the navigator has extensive knowledge of everything the local community can do to help support an individual, from food banks, befriending services, walking groups, specialist bereavement counselling, CBT, arts and crafts groups, all the way through to crisis accommodation options, emergency care options, safeguarding, etc. So they're plugged in from everything from your statutory emergency services all the way through to a photography club at the end of the road where somebody may benefit if they joined, or a gardening group. And what they do is they adopt a pragmatic approach to resolve the underlying issues. So they utilize their knowledge and their contacts to resolve the issue. They almost become a friend who goes out to bat for them. They very much get onto the case to resolve. They're very solution focused, and they see it as their personal mission to resolve the issues that are causing the underlying mental health issues or the anxieties there. And we find this to be hugely successful and often can be done in 1 or 2 sessions. We're also observing a secondary benefit of addressing mental health issues. So, for example, many people with serious mental illnesses such as schizophrenia on average die between 15 and 20 years before the national average. And this is often because of physical health conditions such as heart disease or strokes due to smoking or lifestyle choices, because their mental illness has impacted on their ability to look after themselves. So we've encouraged people to engage in physical activities as well, attend health clinics that they wouldn't, but they don't just signpost them and say there's a diabetes clinic on next Wednesday. They'll book them on, they'll go and meet them, they'll bring the patient to the clinic, sit with them and introduce them, and is very proactive to get them involved. We've seen that it relieves pressure on the health system because patients are getting the outcomes that they want, and they're getting them earlier than they would. So that's consequently equating to less visits on the health system, whether it be ANA or primary healthcare. We're seeing that there's short and long-term benefits to the service user. So as I mentioned before, often the issue that they come is getting solved for them, but also the long-term outcomes are good because their health improves. But we also do things around trying to improve their day-to-day functioning and building resilience, just to give them something to take forward so that they're better able to deal with their own issues. And finally, it's life-changing outcomes that we're seeing. So anecdotally, the service user feedback, the patient feedback that we've collated has demonstrated incredible levels of gratitude, even some insisting that had they not engaged with the navigator at the point that they did, they would no longer be with us. They would have taken their own lives, or they would certainly be hospitalized in secure care or even in prison. And without that intervention. So that's it from me. Thank you for listening, and hopefully I've given you some food for thought there.
Well, we certainly, Jonathan, certainly, I'm sorry. Thus,
Well, I'm talking about education in schools today, of course, and in this case, it's wonderful to see how these workplaces take on a role, I guess, of also talking about skills. David, you referred to the session with the Commission the other day, and I suppose that that's a part of also the skills agenda, and looking wider at the skills that you need to use in a modern workforce. These are learning skills that you need to survive a long life at work. Is this, I think one of the positive benefits here perhaps is that it's not seen necessarily as a sort of a do-good element. It's something that's born out of good productivity in a sense, and I mean that in a positive way. What does it take for this entity, this company, to work in a positive way? Well, work has to be positive. Work has to be regenerative. Work has to give meaning. So are you thinking perhaps also that it's a nice way of also redefining some of these workplaces, that they see over time how they also maintain? We've talked a lot about managing human resources. It's a good point from the chat as well. But managing human resources also means cultivating, means nurturing, means a lot of other things. It's not simply using them.
I think there's another facet to that, Lars, which I suspect Jonathan would agree with, which is if you look at community connectors like this in the context of primary care, then you have an extra strand to the network, the net, which supports people. And it's one that is a real development forwards, isn't it? Because up till now, there was a kind of tribal, grabbing of space and attempts to exclude people who weren't part of one or other tribe, whether it was doctor, nurse, OT, whatever. And this, sorry.
If I can ask a question while you tackle that issue, that mental health issue, David. And it's actually a question from the chat, I suppose. Do you think it takes any extra skills or training to get these mental health navigators up and running, Jonathan? Would any employee be able to be a mental health navigator?
In a word, no, because what we found is we do put the navigators through training. So we do, they have mental health awareness training, first aid mental health. We put them through coaching on how to coach people's mental health to help build that resilience and help improve individuals' day-to-day functioning. So they've got a broad understanding of that. But one thing, and again, it's difficult when recruiting, because a lot of it comes down to the personality and the social skills of the individual. So, for example, one of our navigators who works, they've got to be able to interact with, in 1 hour, they'll be interacting with a psychiatrist or a doctor, and having to hold their own in a discussion about a client. And then they'll be speaking to a client who may well be a sex worker, or maybe somebody who's literally been released from prison and is homeless and is in distress. And you've got to be able to win their trust. So you've got to have the emotional intelligence and the social skills to be able to interact with the whole spectrum and to be able to hold your own. You've got to be passionate, obviously, about what you do. You've got to be a people person. And often that's why the recruitment and the interviewing process is so important, because you've got to get the right person. And a lot of time and effort is put into that. But that's something that it's difficult to put into a job advert, that you've got to have the right personality. But so, yes, we do train them anyway, but that's one of the key elements, is the ability to relate to people and gain their trust and go that extra mile for them.
Indeed, you're constantly looking for people that have a charming personality. And speaking of such an individual, David?
So you're not talking about me, are you? So let's look, Jonathan, thank you. I think this is the shape of things to come, in the sense of, again, it's about moving out of the rigid model of who does what and finding spaces in between which can be filled cheaply, better, more effectively. I want to now switch us, so thanks, Jonathan, to Fatima, who's stepped in at the last minute because her colleague was ill, but who will give us a perspective from, the Rethink Mental Illness was actually an organization set up by, I believe, the parents of people who had serious mental health problems. This is a European organization looking after the rights of people, clients, if you like, of the services, citizens with mental health issues, and their perspective of where things are at present, I think, is really valuable. So over to you, Fatima.
Thank you so much, David, for the lovely introduction. Just going to share my screen, so bear with me for a second. Hopefully that's worked. Yeah, fantastic. Great, happy to hear it. And very happy to also be here and be part of this really engaging discussion. I've been following some of the other webinars that have taken place, and it's really fantastic to see mental health also being specifically discussed, which is, as we know, a very cross-cutting issue. And I'm really thrilled to be following on from Mary and Jonathan's presentation, fantastic presentation. So yes, thank you for the lovely introduction. And as mentioned, I'm taking over from my colleague, Bob Grove, who is Mental Health Europe's Senior Policy Advisor. And so, yeah, I will be filling in for him and doing my best, so bear with me. So I work for Mental Health Europe, which is a European organization, and I work as their policy and advocacy officer. But just to take you through these next couple of minutes, I'm going to be talking a bit about the work we do as Mental Health Europe, as well as specifically the work one of our task forces does in shifting the paradigm. And I'm going to be talking about that in a bit more detail. So I'm not sure if you're familiar, but for those who may have never heard of us, I'm just going to briefly go over what we do as Mental Health Europe and who we are. Mental Health Europe is actually the largest independent network organization representing mental health users, professionals and service providers across Europe. We have over 70 members in over 30 European countries. And in a nutshell, we're committed to the promotion of positive mental health, the prevention of mental health distress, the improvement of care, advocacy for social inclusion, and protection of the rights of users and ex-users of mental health services, persons with psychosocial disabilities, their families, carers, and more. And when I say independent, we really pride ourselves on being independent from influence of industry and pharmaceutical companies as well. So this is something that we always highlight when introducing ourselves. So in a nutshell, Mental Health Europe works really closely with European institutions and international bodies to mainstream mental health in all policies and to end mental health stigma. And together with our members, Mental Health Europe, we're based in Brussels, we formulate recommendations for policymakers to develop mental health friendly policies. And we really place ourselves, we place users of mental health services at the center of our work to ensure that they are provided a platform and the voices of those who experience mental ill health are heard across Europe and beyond. So we really work to promote positive mental health and well-being, prevent mental health problems, and support and advance the rights of people with mental ill health or psychosocial disabilities. So this is kind of a small introduction to who we are and what we do. And where really our work is really influenced and we really follow on from the UN Convention on the Rights of Persons with Disabilities. So this is really the groundwork that guides us in our work. And in this slide, you can see on the last bullet point that we believe that full recovery from even severe forms of mental distress is possible through active collaboration between users, families, professionals, and local communities. And that really kind of ties in with what we're talking about today in terms of shifting the paradigm and working towards mental health system, mental health care that is respectful of human rights as well. So I'd like to introduce kind of this task force called the Beyond the Biomedical Paradigm that is part of Mental Health Europe. And it's been existing since 2012. And it's a special group within Mental Health Europe, which studies to better understand the diagnostic system in the mental health field and the implications for people who use services. So this task force really works to steer the work of Mental Health Europe and pioneer this shift and working towards a psychosocial approach to mental health. And just to mention, this group is made up of individuals from a variety of backgrounds, from psychologists to service users. And their unique strength is really combining efforts to work towards a common goal. So they've done a number of things which I'd like to briefly explain and kind of guide you towards as well. But before I do that, I just want to re-emphasize that the shift from a biomedical model of a psychosocial model to a psychosocial model is enshrined in the United Nations Convention on the Rights of Persons with Disabilities. And as mentioned before, Mental Health Europe really subscribes to the psychosocial approach to disability and works towards a full implementation of the UN CRPD. So I always like to emphasize that. So yes, this task force was established a few years ago, and they really worked to investigate, debate, and report on controversy surrounding the construction of diagnostic and statistical manual of mental disorders, the 5th edition, and the International Classification of Diseases, and really just challenge what exists currently and looking at the best approaches to move away from that. So in 2012, actually, this task force adopted a Bucharest Manifesto, which basically called for, among other things, abandonment of the new diagnostic categories that have no basis in science, stopping the practice of using models and systems which go against the psychosocial model. And alongside this, they've also campaigned for the introduction of sunshine laws, which in a nutshell look at regulations governing and requiring transparency and disclosure between industry, healthcare professionals, healthcare organizations, patient organizations, etc. So really looking at kind of disclosure and information and transparency around that. And they've also, alongside this, they recognize that it's really important to advocacy and targeting policymakers and decision makers, but it's also really important to spread this information and spread guidance as to how we can apply a psychosocial model in reality. So they've produced a number of short guides which enable and aim to support lay people who come into contact with the psychiatric system to understand and be proactive participants in their own treatment, and those closest to them to ensure that they're informed and making informed consent more of a reality in a mental health world. So this is a large focus of the task force's work. And I just want to go on to the next slide, which just shows a few screenshots of some of the resources they've worked on in recent years, which I'd like to briefly explain. And also I'd love to put it in the chat as well and share it so you all have access to it as well. So these short guides are usually compact and aim to be really used practically and be accessible. So to show you a few, there's a specific short guide, for example, on psychiatric diagnosis, which was released in September of 2018. And this short guide aimed to support anyone seeking help from a doctor, psychiatrist, or other healthcare professionals. There was also another short guide that was released called Short Guide to Recovery in 2019. And this one really looks at ways of thinking about managing and overcoming mental ill health. And this short guide was actually developed with people with lived experience of mental ill health, and we received really positive feedback from around the world, actually. Another short guide is a short guide to psychiatric drugs, which was created for people taking medication and is a guide. The most recent short guide is called the Short Guide to Ending Coercion and Restraint in Mental Health Services. And it was actually released just this month, 3rd of June. And this short guide really looks at helping people who come into contact with the mental health system to be active participants rather than passive recipients of care. And what the short guide does is it suggests ways in which people who have experienced mental health crisis and their supporters to make their voices and views heard in taking control of their bodies and lives. So it's a really compact short guide which provides more information on this, and also practical examples of what's been happening in different European countries as to working towards a psychosocial model of care. So I really encourage you to check that out. And the reason why this was released actually in this timely fashion was in relation to, I don't know if you've heard of the hashtag withdrawal Oviedo campaign, and it was released to advocate towards ending coercion and restraint in mental health services, and connects with the current developments in the Council of Europe, which is regarding a draft additional protocol to the Oviedo Convention. You can see the URL in the slide. Just to give a quick background overview, in 2014, the Council of Europe, not to be confused with the European Union, it has a specific committee called Committee of Bioethics, which focuses on addressing ethical and legal challenges raised by developments in the mental health field. This draft additional protocol actually is quite worrying, as it could further cement the idea that others, including mental health professionals, uphold authority over our bodies and can subject them to involuntary treatment and placement. And so this protocol would be an addition to this convention, which is the only internationally legally binding instrument on the prevention of human rights in the biomedical field. So this campaign really highlights that we oppose this draft additional protocol, as it violates human rights, it creates a legal conflict, it solidifies institutionalization, as well as increasing coercion. So there are a number of factors that come into play, which has led to organizations coming together to advocate against this. And there was a small success this month, in which the vote to work towards passing this was postponed until the end of the year, which provides us leeway to really campaign on this and raise awareness. So I would really like to finalize and wrap up this presentation by encouraging you to check that out and check out our short guides to find out and receive more insights on what's happening and how you can also work towards supporting this and supporting the movement towards a psychosocial model towards mental health. Thank you very much.
Fatima, thanks. There are some very special things there you mentioned. I must say, one of the things that was an innovation during my time as a working psychiatrist was the whole concept of the recovery model. And the notion, which again is a move towards seeing the person as some of our other speakers have talked about, holistically, of someone who hasn't just got mental health needs, but also needs to have a life, which is, this issue that you're particularly concerned about in regards to coercion is something we could spend a whole session talking about, because, and I suspect our next speaker might as well have certain views. They wouldn't be necessarily the same as mine, but working with people with very severe mental illness, there is very difficult questions about at what point do you say they don't have capacity, It's a minefield, of course, because what we have learned, I think, from bitter experience in the UK is that you can have checks and balances to look after people's rights. We have things called mental health review tribunals, where people can challenge illegal orders, and they can be very powerful. But if you don't resource them, then the whole thing collapses. And so there is a real risk here, but that's to skip over something that we could spend hours talking about. So I would rather say thank you. We'll have a chance to talk a bit about this, but let's move on to our next speaker. Now, in a way, I wanted to
just add a little comment, though.
Please.
Just to remind you all that there's an after chat. There's an opportunity to chat more, I hope, with Fatima too. But there's actually also one of the reasons why the after chat is there. So just keep looking for the link in the after chat. I'm sure good people like Shannon, I suppose, would share the link. But yes, sorry, David.
Not at all, no. So let's introduce our... I was going to suggest that maybe there might be a little bit of a double act here with Professor Peter Falkay and myself along the way. But he's welcome. Professor Falkay, you came in at very much the last minute, and you've been very good to come and give us your viewpoint, which is really important because you are the let me get this right. You're the president of the European Psychiatric Association, as well as being a professor, obviously running your own department in Munich. And in some ways, you and I are more conventional, have a more conventional view, but probably not quite the same. But I'm very interested for you to tell us all about the particular things that, again, mental health in the time of COVID. First of all, what you feel it tells us about the position of mental health and mental illness, and what impact it's had on your services.
Thank you very much, David. I even prepared some slides very sort of quickly, so possibly I can sort of show them with this. Wait a sec. Here we are. So
Could you put them in full screen, Peter? There, thanks.
He did.
I did.
Thank you.
So my first question was, what did COVID do to our mental health, just overall? And I just like to, well, this is a slide I like to show, because often our impression is that pandemias like the one we just having, the corona pandemia, is something very special to human mankind. But I just like to remind you that there has been like the Russian flu, and there had been the Spanish influenza between 1918 and 1919, and there has been sort of Asian influenza pandemic between 1957 and 1958, and there was a recent one of the swine flu. And Kreplin, who was chair at this department too, he in his time went through that because he was chairperson between 1904 and 22, and remarked that the opportunity during the recent influenza epidemic to observe a great series of psychiatric disturbances which could be linked with various degrees of confidence to the prevailing epidemic. So people saw it that indeed that would influence mental health and mental illness. Post-influential psychosis provided impetus to investigations of exogenous factors in the etiology of psychosis. But I'd like to raise two questions very shortly. One is, what did COVID do to the mental health of the population? And the second, what did COVID do to the mental health organization? So this is very shortly what I'd like to summarize. What did it do to our sort of mental health? And as you can see, we had the first wave. And as you can see, about 84%, this is the green line, They even improved if you actually look at their stress score. So actually it went down. But then we have two groups. One is the blue, that is the adaptive one. So these people develop sleeping problems, anxiety, and things like that. So their stress level goes up, but then they adapt. So they have good resilience, and then they go back to normal. But then we have the sort of left 8% of the people, and they sort of seem to recover, seem to be fine, but then they go into a vulnerable group, and that means they have not only sleeping problems and anxiety and things like that, but they develop things like prodromes of an anxiety disorder or depression. And as I say, I think it is like, what can you do in this situation? You need to know about your vulnerability, and then you can tackle things and actually go and solve problems there. My picture for that is like, if you have a light tan and you go in the sun, you get burned. So what can you do? You just use cream in order to prevent yourself. So there are two things. One is you need to know about your tan, and the second, you need about possibilities to actually prevent your skin burning. Well, I think that for our whole system, COVID was a challenge, as you can see, with all these different measures we took. But overall, this is my summary. Also, many people with severe mental illness develop relapses and severe COVID illness. I mean, we have to say we've lost a considerable number of them. But I think that COVID has forced us to develop telemedicine further. And my impression is that we improved our outreach for living patients remotely, do a better follow-up to our patients, be better in teaming up. And finally, I think that overall mental health was forced to get reorganized, to work more efficiently. So with that, thank you very much. And I'm happy to discuss other aspects too.
That was certainly enlightening, Charles. Thank you very much, Peter. Lars, do you want to comment first?
Well, it is. It's nice in this case to also see such a very data-oriented approach with these data points, and also to show the variations of different groups, how large they are, and so on. And in this case, of course, one of the key challenges here is still that this data gathering could or should go on. We are both for physical challenges of corona. We have long COVID systems or symptoms that we don't know fully understand yet. And the same applies probably to mental health too. What does it do over time? One of the things that I'm mindful of in this case, for instance, that this situation has some resemblance to the way that you over time develop a new mindset, just as some of you viewers out there can remember from the Cold War, where you were constantly worried about things happening and with things being out of your control. And yet you had to relate to it somehow and go about your life and daily business. And I am aware that some can't remember the Cold War, but I'm old enough to do so.
Some of us do.
Yes. But that is a long-term effect. Peter, would you say that this is simply something that people will recover from over time, or that it has a lot of potential for having lasting effects?
Well, as I pointed out, I think you mentioned long COVID. I think that's really one detrimental aspect of the course. And we speak about 10% of the patient with COVID having about mental illness sequelae after having the illness. The other thing is, I think that as all of us were in the risk of developing COVID for a long time until the vaccination came, I think, and even now that we had 3 waves. And so some people say, well, there might be a 4th wave. And there are other people saying, well, I don't know, maybe it's constantly a problem we have to live with. I think it will change our way we lived before. So I think I tried to, for the mental health system, I tried to, put up some positive things. I think for, healthy people too, getting some time to sit together in the evening, because there is nothing you can do but meet people, and which is good. Spend time with people and just rethink how important is it, to be away every evening. So I would say, yes, it changed mental health, but it changed the whole way we interact with each other. So I always say it was bad for us, and it is bad for us, but in another way, it's possibly good to think about what is really important in life.
Yeah,
indeed. Now it's very important that I shut up and give the floor to David. I think.
Oh, is it my turn? Okay.
It is.
Just simply, Peter, I wanted to just explore with you a little bit that very nice analogy you made about suntan and sun cream and so on. After all, this is very much about the theme, isn't it? About prevention, health literacy, whatever you call it, isn't it? People understanding about self-care. I just wondered, though, whether you had an opinion about where does we can understand how people can be taught to look after themselves, and it can start from as early as primary school. Kids now in primary school are being taught about the environment and about and so on and so forth. But what's your view about sun cream? In the sense of who supplies it? Where does one, whose responsibility is it? Because in some ways, one of the things we've lost out really in terms of being really slow to get hold of the importance of prevention rather than illness treatment is who takes responsibility to make this happen.
That's a very good point. First of all, I would be even more critical about, who teaches people to be, aware of their time. Because that's the basic, as you said, that need to be taught in school. I think we improve on that. I think we take, mental health as part of health, or we start to do that at least in the school. But the second thing, and that is very, wisely, this picture needs to be more, precise, not only that you question, who is giving the suntan, but the second is, who is producing it, who is maintaining it, what quality is there, and so forth. So if we speak about preventing mental illness, I think we need to think about a network. For instance, something you have in England, we don't have in Germany, and people don't regard this as important. I think it is. It would be important. It is more important than, actually putting a lot of money in, other structures. And the other thing is, what is effective? Is it effective to, prevent what? To what level? What do you do? So I think these are important issues. And I think that COVID might be a good, way of thinking about this, because you see, it's 10% of the population. So, what happened? So why did some people develop it? What was it? The circumstances? Did they live in a small flat? What about their resources? Did they have enough food and things like that? So I think we need to think about, and I didn't show that slide, but there are certain areas in Germany where you have high rates of COVID, and there are others, low rates. So we need to speak about things like money, resources, and things like that.
Yeah.
So,
Yes, indeed. That's a topic we'll certainly touch on more than a bit in our next session. So thank you for reminding us of that. It's important. Look, I'm going to be self-indulgent, which last respects I might be. And just before we have a general discussion, we might stretch it a bit beyond the half hour.
I would like to present the next speaker, though. Well, Dr. David Sommick, actually, for a brief talk about the elephant also, that we should also remember to talk about. And afterwards, we'll introduce a general discussion among our good speakers. But David. Please.
I'll make this very quick, and I'll ask Rick to be really helpful and put my slides up, because I'm useless at doing this sort of thing. Thanks, Rick. So if we have full screen, anyway, there we go. So the next slide. Okay, this is really, I love to show a cartoon when I'm pontificating, and this is the whole point. It's the elephant in the room. He's talking to a psychiatrist saying, why doesn't anyone see me? And the point about this is, and it's really, I want to make just this one point, but I believe it's a profound one, which is, I believe that in all this talk of a mental health pandemic, of course, and we've heard very helpful, intelligent descriptions of how that mental health problems can be exacerbated by a major event, whether it's an earthquake, a pandemic, a war, whatever. But there's something else going on which people are ignoring. And so if we take my next slide, there was a whole thing about happiness indexes. And there seems to be a strong consensus that there are all these things people need to feel okay about themselves. Good health, enough money for their food or whatever they want, good social relationships, a job, feeling safe where they are, having somewhere to live, and just generally feeling that things aren't, the ground isn't constantly moving under their feet. And the trouble is, if you look at those list of things and you think about young people in parts of Europe and elsewhere, you can see why a lot of those things aren't maybe as good as they might be, and that's going to affect their sense of well-being. Next slide. But the other thing, because I'm an old psychiatrist, and I hate to admit this, I used to work as a psychoanalyst, there's another issue here, which is about the nature of the quality of human relationships in society. And these are the things that I think matter as much as those, what I would call structural elements I showed you a moment ago. And you can argue, if you look at those things on the left, you could say they're all fluffy, things, idealistic nonsense and so on, and they're not rational. But actually, we would argue as psychoanalysts, for example, that these four components are actually elements of a mature personality, and that the ability to be kind, have compassion to others, to tolerate things, to allow different opinions, to respect people genuinely, not to play some game about respecting, but actually we define it in psychodynamic terms about allowing the other person to be separate from you, to be themselves, and empathy, which I don't need to explain. But of course, it's not, those things are really important, but it's when you get the other end of the spectrum that it matters. Because if there's less compassion, there's more cruelty. And I can just look at my own country and ask about the nature of our immigration policy and how it's carried out. Tolerance. I mean, there's less and less ability to put up with people with different views to yourself. And respect, I think, often is dealt with in a kind of very tokenistic way. And the problem about empathy as well, isn't it, is if you have a sense of not belonging in society or feeling alienated, it's very difficult to feel empathy for people. And I would simply say how much of these characteristics really are valued and promoted in your society. It's just a challenge, really. People would say I'm making a fuss about something, but the whole point of this argument is if people are getting less and less mature in their attitudes to each other, in being able to carry out loving relation and meaningful relationships, then inevitably it impacts on the structure of society and the way people feel about things. And the more things tip in one direction, the more obvious it is that all kinds of mayhem may occur. And in a way, this is the background that it's been there for a number of years, which COVID simply, again, I think shows more clearly that there's something not right going on. Anyway, that's my little lecture. My last slide, it comes back to the elephant, I think, just saying, because the real issue is, okay, so what, but what can we do about it? And that is a huge problem, as the elephant seems to agree. Anyway, that's my little speech. Okay. Thanks, Rick. So can we?
I'm reminded by the simile of when a patient or a guy comes to the doctor and talks about a problem his friend has. So in this case, what do you think, David, that the elephant really thinks about this? But still, let's invite also the other speakers into this discussion. I hope you can turn on your cameras too, because it is, of course, essential. The question that the elephant raises here: how are these qualities actually valued in our societies, and how can we boost those to ensure that we can actually then remold this? Peter talked very eloquently about that, the need to do this post-COVID, linked to some of the things we'll be discussing in our session next week, the determinants. But are you, well, that's a basic question you can ask. Are you positive towards this, or slightly dismayed, as the elephant was? It was an open question, but allow me to ask Peter. And in Germany, then, would you feel that you're positive towards how the society values this going forward?
Well, I would say that depending on the new government we will get by October, hopefully a lot of, let's say, good ideas will be carried on. Yeah, I think that, as I said, I think that COVID, faced all of us, to stop and rethink and, and get into a discussion about, we can't predict things, and, life is not, like a machinery going on, but you need to stop and say, what is important? These are the things what David listed. I think this is so clear. This is actually the core, of relationship. And but I think a lot of people have lost ground to that. So I think
placing a lot of faith in the next election, Peter. That's of course. Yes.
Face the people and see
what. Yes. I agree. We should always place a lot of faith in the next election. I mean, that's the power of democracy. Mary, please. Maybe in Finland, are you also hoping for the next election, or would you say that it's more integrated by now?
I would say it is more integrated. We actually have local elections on next Sunday, and I'm not thinking then when I'm saying this, but I would say it is more integrated. We have been working on mental health promotion at MIELI Mental Health Finland for 20 years now. And now it seems that we have had some kind of breakthrough in the Finnish society. For instance, our national mental health strategy has quite strong sort of like focus on mental health promotion. So I would say that it is recognized more and more in different sectors of society, also at workplaces. And I think there really are, people are really valuing those 4 qualities that David presented more and more, and recognizing that what kind of benefits they also bring to us if we sort of cultivate them.
Thank you. And that brings me then back to the UK, I suppose, Fatima and Jonathan. Are you feeling that there's are you on the precipice of a breakthrough there too?
I don't know if we're on the verge of a breakthrough. I think we are making strides towards it. Certainly, the social stigma is being addressed, and is better, and we are slowly getting better at it. But again, I mean, I'm hopeful for the future because I'm positive, and I know from myself and my colleagues that the energy and desire to create better society and enforce these values is there. So I do believe that will come. I do think the sections of society that are unhelpful, and a big concern of me is the social media side of things. And I do think there's a lot of work needs to be done to address that. It's at times it is a toxic environment and does set us back a bit. And certainly the effect that it's having on the youth of today, who are the future leaders of tomorrow, it does concern me. We don't seem to have the ability to have an intellectual disagreement these days. It's, you know, if somebody disagrees with your perspective, they go out of the way to trash you rather than engage with you in a meaningful manner. So I am broadly optimistic, but do have concerns reference the power of social media.
I guess it's also very nice to be on the verge of a breakthrough than on the precipice of it, but that's an interesting metaphor I created there. But Fatima, how about you?
Just to add on, I mean, I completely relate, and definitely staying optimistic, but there are, of course, concerns as well. I mean, I think Jonathan touched on the UK perspective, but at a European level, you definitely do see mental health being more and more on the agenda and discussed. I mean, mainstreaming mental health is really, really important. And for us, it starts with dialogue, you know, talking about it, putting these values at the forefront and seeing how it fits into different areas, and centering those who have been affected and are experts by experience is really important towards moving to a better approach and a better reality, because we can talk about mental health and kind of what needs to be done, but being proactive and also raising awareness and integrating it everywhere is crucial, and it's what we all strive for, I think.
Very good. And it's, I guess, time for you, David, to give the final comments on how the elephant can we make the elephant just smile a bit?
I think what we've just seen illustrated is that the familiar story. I'm a glass half full versus half empty person. With some of these guys are half full, which is great. But the truth is, it can go either way. I think the fact that you're talking about precipices is relevant. What we do know is human beings are resilient. Fundamentally, that's why we're still here, despite the fact we're so stupid. We don't learn from experience and so on, but somehow we're carrying on. So you've got to be optimistic, but I think there's a lot of pain ahead. But the more we understand what that's about, the more we can help people deal with it.
Indeed. But I think we should thank our speakers, our great team for today,
So.
and give the floor back, or the mic back, to Jim. Thank you very much for joining us today. We'll see you next week when we talk about health inequalities.
Thanks.
Boy, thank you so much. A quick question, Peter. I didn't catch in your data, were those statistics drawn from Europe, the world, a country? What's the source?
Very simply, it was just a region in Germany. It's in the south of Germany, and the population was, I think, altogether 5,000 people. You know, very well, but I mean, if you look in the literature, I do like to show this chart because it's roughly 10% of the population would have problems in a situation like that. And, you know, it is the interesting thing. I thought, you know, 85% are fine, you know, that's the good news. But then
Yeah, I was delighted to hear that statistic. I thought it would be much lower. So that's very interesting. And so it's about 10%, roughly. Roughly. Gotcha. That's interesting to know. So thank you. And David, I was so struck by your cartoon. I'd love to have you send that to me, because that is, sometimes I feel like there are so many elephants in the room. We're actually in the middle of a herd of elephants.
Yes.
And you know, that's what struck me about that was the comment from Rajendra, the quote from Krishnamurti, that it's no measure of mental health to be well adjusted to a profoundly sick society. And I think that's just something that is worth noting, that our whole social structures are, I think, askew very deeply, accentuated by the pandemic. But all of us are traversing some very deep, both conscious and unconscious terrain as we just live out our lives. Yesterday, for example, there was a discussion of President Biden's military, nuclear, and foreign policy as the president left for Europe and the G7 and the summit for Vladimir Putin. And Bill Perry, a former Secretary of Defense of the United States, says that in his opinion, the nuclear situation now is more dangerous than at any time in the last 75 years. And the reason he says that is because he says things are so chaotic. You don't know anymore, given the sophistication of technology, what is a trigger and what is not, so that the probability of blundering, as he put it, is higher now than ever before. You know, we carry that stress right in the background of our psyches and we don't even know it. And the other point I wanted to just also comment, Fatima, I think you were bringing in a very, very interesting notion around coercion. You know, coercion, as you indicated, around, you know, the specifics of mental health. But I think it's worth noting that someone like Yuval Harari, you know, the author of Sapiens and Homo Deus and 21st century lessons for the 21st century, believes that coercion, actually, public coercion by governments, is the most dangerous implication of COVID. And he makes a very compelling point that it's not just the public health. We're going to solve that one way or the other. He says it's the threat to democracy and the rise of authoritarian coalitions. You know, you see it around the vaccination. Do you force people to be vaccinated? If people refuse to be vaccinated, what do you do? We had a case here in the United States, for example, at a big hospital in Houston, Texas, where nearly 800 of the staff in the hospital refused to take the vaccine. And they said, we don't believe it's efficacious. There's side effects that the public is not being told about. And so we're not going to take the vaccine. And they took it to court. And in the end, the coercion won, and they were all fired yesterday from the hospital. And so this issue of coercion in public policy generally, and then how it affects the mental health of all of us, is a major issue that I think needs more careful study. So Lars, David, I just want to note this whole issue of of coercion. I think that's worth a whole panel, and maybe Fatima, you could come back one day and you and others could explore it more deeply, because we're in a world situation where rising authoritarianism and rising coercion is having deep inroads now into our democratic systems, both in Europe, certainly in the United States. And you see it in Brazil, you see it in India, and elsewhere. And how we all deal with this, psycho-emotionally, much less politically, and in terms of the instrumentality of government, is a major question that I think, like race, with the death of George Floyd, is one of the elephants in the room. And I think it's worthy of a deeper comment and exploration. So Fatima, I wanted to thank you for raising that issue.
Thank you.
And thank you, everyone. This has been, once again, a splendid session on the public health that all of us are participating in one way or another, as the whole world traverses through this extraordinary, I would say almost a rite of passage of lockdowns and physical distancing and wearing masks and staying alert and being uncertain of the future, and seeing people around us dying, getting sick, and out of work, and dealing with an ongoing duress that is corrosive to human well-being, unless there's a strong community and a deep sense of caring. And that's what we're trying to create through Humanity Rising, is just a global community of people who deeply care, who come together day in and day out, Monday through Friday, and just share together energetically with an open heart. That's why we start with a heart coherence. We just want to bring everybody into the same heart space. Because in the end, if that sense of community, that sense of purpose, that sense of well-being, that is the foundation of health, both physically, psychologically, emotionally, and communally. So thank you, everyone. A wonderful session. And then tomorrow, I thought that we would take a pause and contemplate the history and the mystery of Chartres in France, just west of Paris. There's a cathedral there, Chartres Cathedral, that is considered to be the queen of cathedrals. And I'll be sharing the history of that sacred place. It's been identified as a locus of deep feminine energies since it was first discovered 3,500 years ago by the Druids, who, when they came to Chartres, there was a big mound, and they sensed a very deep feminine energy that was so strong. The Druids, who were the masters of the mysteries and the invisible realms, they considered Chartres to be the most spiritually potent site in all of Europe. And every year, all the Celtic people would gather together for their Vatican, which is a Celtic word for seat, around the hill of Chartres. And that's where Ubiquity University has built its Chartres Academy. So I thought we would just take a pause and contemplate one of the great mysteries of the world, where the earth energies themselves influence human spiritual insight, and contemplate what we can learn today from the sacred feminine. So that's tomorrow on Humanity Rising. Thank you, everyone. We'll see you again. Bye for now.